We're staying with international stories now. China's neighbouring country, South Korea, has heightened airport screening. They've also resorted to strict disinfecting routining. This follows the confirmation of another case of coronavirus. People are now concerned about widespread pneumonia-like illness during the Chinese New Year travel rush. For the latest, we're joined by our correspondent, Patrick Fok. A very good morning to you, Patrick. At the last count, 4 people had died. What is the latest?
Yeah, well, the death count, as far as we know, hasn't changed as yet, but there have been a lot of new developments that have emerged just in the last 48 hours, and they are all particularly worrying because of that big travel rush that you talk of. And many people, millions, hundreds of millions of people, I should say, are traveling across the country this week to visit family and friends for the Spring Festival holiday. Critically, there's one bit of information that's emerged just in the last couple of days that is so important and so worrying, and that is for the first time Chinese authorities have said that human-to-human transmission is possible, and they have identified specific cases of that. Up until now, it wasn't entirely clear if that was possible, and that makes the risk of it spreading so much higher, especially at this time of year. One of the things that people are talking about is the potential emergence of a super spreader, someone who carries the disease and is able to infect others quickly and easily. That is something that people are very worried about indeed. But one of China's top respiratory diseases experts has said he doesn't think it's as bad as in 2003, and he said it doesn't think it'll have the same impact, not least because health authorities here actually identified the virus 2 weeks after it was first discovered. If you remember, SARS took a lot longer to discover, but still there are a lot of concerns. We don't know where the virus originated from exactly, although it's suspected it crossed over from animals to humans at a market in Wuhan, and still there's no cure.
And also, the World Health Organization is wanting to get involved. Do we know what form their involvement, what shape it'll take?
Well, yeah, that's right. On Wednesday, the WHO is going to be meeting to basically decide whether or not this is an international health emergency. And then from there, they will decide on specific steps to take, whether or not they're going to have to restrict travel around the world. In fact, this health expert that I've been talking about, he has actually suggested that people in Wuhan, ground zero for the virus outbreak, if you like, who are detected to have flu symptoms, should be contained within the city. They shouldn't be allowed to leave. And of course, a lot of efforts are being made to screen people at places like airports and railway stations. But one of the difficulties is that this is peak flu season anyway, and a lot of the symptoms are quite similar to regular colds, regular flu, and so on and so forth. So, it is a difficult thing, and as I say, because of this human-to-human transmission element, it's going to be potentially much more difficult for authorities to contain now at this point.
One of the global economic factors is that the Chinese people are some of the highest numbers in terms of movement around the world. Is this causing concern?
Absolutely. This is the largest global annual migration, and one finds it difficult to understand why authorities weren't quicker about sharing information about all of this. There has been a lot of criticism leveled at authorities for the lack of information that's been shared with people, and people have been speculating for weeks that the problem is a lot more severe than they've been letting on, particularly because up until a few days ago, they'd only revealed cases happening in Wuhan. Up until a few days ago, there were only 62 confirmed cases, and and just in the last couple of days, that's jumped to well over 200. So it's difficult to understand why they've taken this approach. Some of the health experts I've spoken to have actually said, in terms of tackling the outbreak, trying to identify the virus in the first place and trying to clean up the market in Wuhan, for instance, there's been no complaints about how Chinese authorities have done that. But as far as when it comes to sharing information, that has been lacking, and has led to criticisms with some people saying that they haven't learned from the mistakes from SARS in 2003, and this may cause the problem to be worse.
Quite concerning, this revelation that it can spread between people. I know I've asked you this question, but I don't think we touched on it sufficiently. How does it present in terms of symptoms?
Well, the symptoms, like I say, are quite similar to common colds, common flu, fevers, temperatures. Notably, one difference that we're told about is that some of the people that have contracted the virus are showing lesions on their lungs, which can be seen on X-rays. That's perhaps something that is worrying. As far as we understand, it's not quite as lethal as SARS was. As I say, only 4 people are known to have died from the disease so far. But there's also this report that came out of a group from London, the MRC Global Centre for Infectious Disease Analysis, which said that the number of people that may have contracted the coronavirus is probably closer to 1,700 people. And that is a much bigger number still than what we know about right now in China. And as far as trying to keep safe individually, people are being told to wear face masks and try to stop themselves from going anywhere near animals, or if you suspect yourself of having flu symptoms, to go to hospitals. But right now, certainly it seems as though if you contain people, it will help prevent the spread of the virus.
What you were saying earlier about authorities not being criticized for not giving sufficient information, are we seeing a turnaround in that, or is the status quo remaining?
It certainly seems so, and President Xi just in the last 24 hours has said that people's lives have to be made the top priority. That seems to have prompted a little bit of a turnaround, and we are getting information much more quickly than we had been. But this is something that's really damaged the credibility of health authorities, and it's hard to understand, as I say, why they weren't sharing this information beforehand. Presumably it could have helped prevent some of the people contracting the disease if they'd been advised on what they needed to do to protect themselves, and so on and so forth. Perhaps it's because they didn't want to cause panic, and perhaps they thought it might have been damaging to China's reputation. But for whatever reason, they haven't shared information quick enough, and that has, as I say, damaged their credibility to some extent.
Patrick Fok, thank you so much for that update.